same time. Even just doing two out of those 4 things is a stretch for me on some days. Okay, let's officially start. Welcome everybody to IsisParenting's breastfeeding webinar and chat. My name is Nancy Holtzman. I'm a mom and baby nurse educator, board certified lactation consultant, and board certified in pediatrics. I'm here at IsisParenting's home office outside of Boston, Massachusetts, where we have 4 centers in the Metro Boston area. We have 4 centers in the Atlanta, Georgia area. 2 of them are open already, Dunwoody and Alpharetta, and 2 of them are opening within the next week or so, Kennesaw and Smyrna. And then we have 5 centers that are opening in the Dallas-Fort Worth Metroplex area within the next week. So if you have friends or family in those areas, please spread the word and let them know that ISIS is coming to them, and they can hopefully come and experience the education and support that ISIS brings. Okay, as I mentioned, today is all questions and answers day, and we're going to start off with a question from one of our regulars, Christine. I'm going to scroll to some pictures of solid foods and bottles and childcare because her question is about how much milk a baby will gradually be taking as they start eating more foods. And since I can only scroll forward and backwards in my slides, you really can't I can't just pick a picture and go to it. So let's see, let me read her question out loud. Here we go. My 6.5-month-old has been doing solids once or twice a day for a few weeks. So far, I've been sending and he's been drinking the same amount of breast milk throughout the day at childcare. He's there 8.5 hours and averages 16 ounces in bottles. Should I be expecting this to drop at some point as the amount of real food is increasing? And for how long should bottles continue to be the primary delivery method of the breast milk? I don't have any interest in weaning, and he doesn't seem to either. I'd like to continue breastfeeding for as long as possible. Christine, if you were here, I would give you a great big hug and a pat on the back because I don't know, somewhere along the way you've gotten good advice. You're doing well. You're really doing well. He's there for 9 hours. He's drinking 16 ounces of milk. That sounds great. He's 6.5 months old and he's eating a couple of times a day, which is young, but for a baby in childcare and with the newer research that makes me feel a little fuzzier in terms of introducing solid foods between 5 to 6 months instead of waiting all the way to 6 months, which is still the official recommendation. But again, it's a grayer area where some research seems to indicate that maybe it's okay to start earlier, around 5 months, and that perhaps in some situations in terms of allergies, there's actually a benefit to introducing solid foods on the slightly earlier side, meaning 5 to 5.5 or 6 months rather than waiting until after 6 months. There is some emerging research that seems to show that introducing foods containing gluten, again, like wheat and things like that, earlier rather than delaying those foods, perhaps may help prevent the increase in celiac diseases that we've been seeing lately. So anyway, it's a murky area, but it certainly does not concern me, and I think it's a positive thing where you have a 6.5-month-old who's happily sampling solid foods a couple of times a day, is nursing well, is drinking express breast milk from the bottle. It's all going well. I would not expect his milk intake to decrease significantly for a long time, but what you will see is that his solid food intake will increase. He's going to need more calories, slightly more calories and nutrition. So think about his breast milk intake as roughly staying even, but the difference is going to be the quantity and the frequency of solid foods that gets layered on top of the breast milk. So as he gets older, so perhaps at 9 or 10 or 12 months, he may take 3 bottles that are 5 ounces or something like that. His milk intake, it may gradually drop as he gets closer to 9 to 12 months, but it's not going to decrease hugely. It will stay at 6.5 months. It's going to stay where it is, I would think, for another couple of months. And gradually, he'll increase the volume and the variety of foods that he takes. Sometime over the next 1 to 2 months, you probably will begin to introduce more protein foods, the meats and the poultries and things like that, as well as more variety of grains, various fruits and vegetables. As we've talked about before, there's so many different ways to introduce solid food. whether you choose to do purees and spoon feed or you choose to do baby-led weaning. Some babies very quickly tolerate mashed foods and lumpy foods. Other babies have a very sensitive gag reflex, and they need things. They need things either very, very pureed, or they do better with dry, crunchy, but not wet, mushy. So, for example, there are some babies who can eat a cracker or Cheerios, but if you tried to mash a banana with a fork, they would gag and vomit because of the mixed texture. The lumpy and the liquidy together make them gag. So you see a variety. But it sounds to me like you're doing well. I wouldn't change a thing. These are the types of foods that you can feed a baby from 10 months or so. Introduce a variety of whole foods, simple foods, fruits and vegetables, whole grains, poultry and meat, and some dairy products. And then gradually around 10 to 12 months or so, and earlier too, if your baby is interested and tolerates it, modified table foods. And these hopefully are the foods that you eat and not short order cook, so that you're making one meal for the family and you're making chicken fingers and French fries for the toddler. We train children to eat that way. We train them to expect that the kids' menu foods, the pizza, the peanut butter and jelly, the chicken fingers, and the hot dogs and hamburgers and the French fries is what they're expected to eat. If they are presented with sweet potatoes and salmon and roasted potatoes and so on, and that's what the family is eating, and that's what they grow up eating, chances are that's what they'll eat. Now, when it's your first child, I have a few sayings. The first child gets homemade, pureed, organic baby food. The second child gets the jars, and the third child is scrounging for pizza crusts under the kitchen table. So that's one saying I use. And another saying I have is the length of time, effort, energy, and care that you put into creating your child's meal is a direct negative correlation with the likelihood that he or she will eat it. So my example there is, your organic, free-range chicken breast, panko crusted, oven roasted chicken fingers, your child will turn their nose up, and when you just microwave the Purdue chicken fingers, they'll gobble them down. So don't be too emotionally invested in the food that you are making and presenting to your baby. The best bets are to offer a variety of colorful whole foods, and always offer one thing that they typically eat, and try to have the mindset that your job is to present the foods and their job is to figure out and decide how much and what to eat. You can facilitate that eating when they're younger, but pushing and encouraging one more bite, and then setting up struggles or threats like you have to eat 3 more bites, or no dessert until you finish that. Those tend to be very counterproductive. Okay, let's see. Did I answer all of those questions? I think I did. Okay, here's a nice question from another regular mom. How much expressed milk should an 11-month-old be getting while with a caregiver? Is 10 ounces enough if we are nursing AM or PM? Yes. I don't know how long your little guy is with the caregiver. So is 10 ounces enough if you're away from 18 hours? Well, he's not going to dehydrate and he's not going to become malnourished if that's not a daily occurrence. If assuming that you're talking about a 6, 8, 10-hour separation, 10 ounces for an 11-month-old is probably 2 bottle feedings of 5 ounces each. And it depends what he's eating too. Is he eating a couple of meals of solid foods in there? Is he a chow hound? Does he eat a whole little carton of yogurt? I would say just in general, a child that's nearing a year old is would probably be getting at minimum 4 to 5 what I call milk feedings in a 24-hour period. So he may be getting twice that, and that's fine. So if you're nursing him 2 or 3 or 4 times a day, and then he's getting a couple of bottles in childcare, he's getting plenty of milk, breast milk. And if he also eats a yogurt or some cheese or cottage cheese or things like that, he's certainly getting plenty of calcium, protein, and fat as well. Here's another question about expressed milk. How much expressed milk should a 1-month-old get when she takes a bottle instead of breastfeeding? Is 2.5 ounces okay? She's 7 pounds, 10 ounces. Congratulations, Mama, with a 1-month-old. Yes, that actually sounds good. It's a generous portion of milk, 2.5 ounces, but it doesn't seem over the top or excessive. I do encourage you to use a slow flow bottle nipple. And in general, when bottle feeding a breastfed baby, some good rules of thumb are to pace the feeding, what I call upright, slow, paced, responsive bottle feeding. And I wonder, do I have a picture of that? I think I do. Hold on, I think it's on an unrelated page though. That's kind of a picture of paced bottle feeding, the little preemie there. But let me find, I think I have another picture. There we go. This is what I wanted to show. So you want to use a slow flow bottle nipple, and you can see in the upper left corner, this mom is bottle feeding a doll, and that's actually Penny, who works here at ISIS. And I needed a picture, and I sat her down in a chair and slapped a baby and a bottle in her hand. And the baby could be sitting a little bit more upright with the bottle a little bit more horizontal, but that position's not too bad. What you don't want is the baby completely reclined with the bottle perpendicular on top of the baby, because it's going to flow faster by gravity. And even if you are at 1 month, you're probably either you or your family member or your partner or somebody that that you're there and can instruct them how to feed the baby the bottle. When a baby is older and in childcare, you may not be able to, you can request how you would like the bottle fed, but you're not there to supervise, and you really don't have a whole lot of control if they've got 4 babies that are hungry and they've got to put 2 babies in bouncer seats in front of them and double fist the bottle, so they're feeding 2 babies at the same time. You don't have a whole lot of control over that. But what you do have control over is the bottle nipple that you're attaching to your baby's bottles. So please do stick with the slowest flow bottle nipple that your baby and the caregiver will tolerate. And even as your baby gets older, if the bottle nipple package says 0 to 3 months, it does not mean that you need to move to the next size flow rate just because your baby is now 4 months old. It really should take 20 or 30 minutes to do a bottle feeding. So if that 2 ounces or 3 ounces of milk that you're giving your 1-month-old, if your baby is guzzling that down in 10 or 15 minutes, I would look at the bottle feeding position and the type of bottle nipple that you're using. And sometimes, even though it may be a slow flow bottle nipple, a different brand may work better for your baby. So really aim for that sweet spot of close to 30 minutes, 20 to 30 minutes to feed that 2.5 ounces of milk. Because as your baby gets older, they can become accustomed to the very rapid, easy flow of the bottle, and then they come to the breast and they get a little ticked off that they have to work and they have to wait for the milk to flow. And so that's where you start getting, it's not really nipple confusion so much as flow rate preference. And that's what I was showing in the initial slide before. So the volume of milk that you're asking about, 2.5 ounces, is a generous portion for a 1-month-old 8-pound baby, but it's not crazy. And as long as you're delivering it over at least 15 to 20 minutes, preferably longer, I think that is fine. What a lot of moms will do at 4 and 5 and 6 weeks is get into a routine where they're expressing milk in the morning, perhaps after breastfeeding, maybe a second time after breastfeeding later in the day, depending on how much volume of milk they're expressing, and then alternate between feeding the fridge and feeding the freezer. That means starting to store some milk away in the freezer for longer term storage, perhaps for when you're going back to work as an example, and putting some milk every other day in the refrigerator. And that's the milk that your partner can use to practice bottle feeding and to keep the bottle familiar. And you may be able to have your partner do a nighttime bottle. So sometimes people will use the milk they express in the morning to give to the baby before bedtime if the baby is cluster feeding in the evening and nursing and dozing and nursing and dozing, and then you can kind of give them a top off of a couple of ounces of milk that you expressed earlier that day, and then everybody hopefully can go to sleep for 4 hours. Another option would be to nurse and to put your baby down for the first chunk of sleep. And then at 11 or 12 or 1 a.m., when the baby wakes up for the first time, have your partner use the milk that you expressed to do a bottle feeding, a diaper change, and get the baby back down to sleep, hopefully. Well, you put earplugs in and the pillow over your head and try not to listen and get up, but instead try to sleep. And then when the baby is up again 2 or 3 hours later, you're back on duty and back breastfeeding. So you actually do skip that feeding, and you may be quite full, but as long as you are expressing that milk that the baby is getting in the morning when your supply feels more abundant, and as long as your body seems to adapt and adjust, even though it feels a little bit fuller, you're still within a 24-hour period, you're still fully in sync with the baby's milk needs. Okay, next question. This mom has 4-month-old. I was nursing before each bottle. Let's see, is this a continuation? No. I was nursing before each bottle only when I am with the boys. Nursing before each bottle only when I am with the boys. I work full time. I know I only produce between 1 and 2 ounces per side. So then the boys get a good sized bottle. They have recently started complaining, yanking, pushing away after a minute or 2 of starting. Are they too used to instant and constant gratification with bottles? I guess anything I can do to stop this. Side question, baby's still on size 1 nipples. Do I ever have to move up? Okay, I think I actually answered some of that just a minute ago. And that's what this picture really describes, is that, when a baby starts getting a lot of bottles, they get accustomed to the immediacy of the milk and the rapid flow rate, and not having to do a whole lot to get the milk to come. And then sometimes they do act out at the breast, and they kind of tug and pull and squirm around because they're a little ticked off by it. But and you have twins. I think really the best bet is to try to keep your milk production up as high as you can, so that they don't have to struggle for each drop, and then each drop is kind of marginal at that. So if you're keeping your milk supply at its max, and of course that's different for everybody. And I have some webinars that talk about increasing milk production, and covers all the FAQs about, things that may work and things that don't work, and all of the foods out there that people say you should eat, and then herbs, galactagogues they're called, and even prescription medications that sometimes people ask about to help boost milk production. But my point is that if you are going to be doing bottles of formula and breast milk, and you want the baby to breastfeed and take the bottle, your best bets are to use the slow flow bottle nipple, the pace responsive bottle feeding, which is trickier when you have twins, because let's face it, there are times where the caregiver has to put them in their bouncer seats and sit in front of them and feed them both at the same time. That might happen, and that's real life. It's not the end of the world. As long as the bottle is not propped and the baby, someone's there interacting, touching, talking to, loving the baby. Sometimes babies are eating a bottle in the bouncer seat or the car seat. That's the way it is. So no, I think you're doing okay with that. Another thing you could try is you could try just experiment. I'm not saying this is the way to do it, but if they're hungry, nursing before each bottle. If they're hungry and they're getting frustrated and tugging and pummeling at the breast because it's not going fast enough, I might start that way. But then what you could try is you could try flipping it and doing it backwards. So you could try giving the baby a couple of ounces of milk from the bottle, so either expressed milk or formula, whichever you're using, and then put the baby on the breast. And maybe if he's not as frantic and ravenous, maybe he will settle in for a longer, more satisfying breastfeeding. It's just something to think about or try. You may also notice that like pre-nap or pre-bed or in the evening, when the baby's just kind of want to cuddle and suck and be all cozy, that they nurse easier and longer. But your best bets are the slow flow bottle nipple, and no, the only reason to move to a faster flow rate would be if the baby or the caregiver is getting so frustrated because it's taking so long to drink the bottle. Imagine if you were thirsty and I gave you a glass of ice water and then a coffee stirring straw to drink from it. You would just be sipping and sipping and sipping so hard, to get so little, it would be annoying. So you would want a normal straw. So it's kind of like that. But as they get older, their suck gets stronger too, and so they can pull milk faster through the bottle. And I would just keep doing what you're doing. Okay, next question. My baby boy will be starting daycare in a few weeks. He'll be 12 weeks old then, and since he's mostly been breastfed, I have no idea what to send with him. How many bottles and how many ounces in each? Right now, he usually feeds every 1 to 2 hours. When does he have a bottle? When I'm out, he takes about 3 ounces. Excellent. Congratulations. I have some bottle feeding. I think I have some getting ready back here. Hold on a second. If you haven't, no, not here. If you haven't already seen, I have a whole bunch of webinars that help you get ready to pump at work, whether it's secrets of milk storage, hands-free double pumping. I think actually this is some of those slides. Hands-free double pumping. I hope you have a hands-free pumping bra. Getting into that routine. It sounds like you're already starting to store milk. I hope you're a couple things to be doing ahead of time since your baby will go to daycare in a couple of weeks. I don't like to say you should be this, you should be that, but my best advice would be to be in a pumping routine now so that you can be putting a few ounces of milk additional, either in the fridge or in the freezer, so that you can be making sure that he still will take a bottle. You're going back to work in a few weeks. I would encourage you, your baby is probably 8 or 10 weeks old. I would encourage you to be giving a bottle every other day or so. It doesn't even have to be a full bottle. If your goal is to just keep him familiar with the bottles and you want to mostly be putting milk away in the freezer, you could give him an ounce of milk in the bottle, breast milk in the bottle, and then put him on the breast to finish the feeding. So if you're expressing 3 ounces of milk a day, you could be putting that in the freezer every day. And then every other day, you could just put an ounce of milk in the bottle to practice with or to keep it familiar. And let's see, I was getting toward preparing for childcare. And I have a nice webinar called Childcare, Caregivers, and Breast Milk and Breastfeeding. So it really talks about some of the mindset and attitudes to have your childcare environment be an advocate toward the breastfeeding. And certain things sometimes do come up because formula-fed babies, the parents are not as anxious about exactly how many ounces go in the bottle and how much is left over and so on. If you're going to be using a corporate daycare, so for example, Bright Horizons, they have a breast milk waiver so that if there is a significant volume of milk left over in a bottle, they, with a breast milk waiver, they can put that milk aside and send it home with you. But at least here in Massachusetts, child care facilities need to follow the Department of Public Health guidelines, and any accredited childcare environment has to follow whatever their governing bodies rules are. And often those rules will say that anything left in a bottle after an hour after the baby has started to drink from the bottle, an hour later, the milk must be discarded. So a formula-fed baby, mom may send 5-ounce bottles for a 3-month-old because if there's an ounce left over or an ounce and a half left over, it's not a big deal. For a breast milk-fed baby, moms typically want to make the bottles just the right size so that the baby usually finishes it, but there's not a lot left over. But for a childcare provider who doesn't see a lot of breastfed babies, it makes them nervous to have a baby finish a bottle because then they assume the baby is still hungry, which doesn't have to be the case. If the baby drinks 3 ounces of milk and that keeps him content for a couple of hours, it's the right amount. So I often finish my lunch. That doesn't mean that I should have a bigger lunch. It means that I enjoyed the food I was eating and hopefully it satisfies me until, my mid-afternoon snack. So this picture here is a nice little representation of sending milk to childcare. A full day at childcare, typically you're going to send 3.5 feedings. And obviously, since you're just starting out, it's hard to know exactly what to send. I would make your bottles, I don't know, I would maybe start with 3 to 3.5 ounces. You're saying he routinely takes 3 ounces. That makes sense to me. I might send 3 bottles that are 3.5 ounces, and then I might send 2 more bottles that have about 1 to 2 ounces. And I call those snack packs because if a baby downs a 3-ounce bottle and then still seems hungry, if they can give him a snack pack that's just another ounce of milk, or say you're due to pick him up at 6 o'clock and it's 5:30 and he's screaming, then they can just give him a snack pack rather than a full bottle. Because if they were to give him a full bottle, then anything left over they would have to discard. So I would send 3 bottle feedings and 2 snack packs and hope that he actually doesn't use both snack packs. And realize too that it will take at least a week there's three people that have to get adjusted. So the baby needs to get adjusted to the new way of eating, and the new environment and the new caregivers. The caregivers need to get adjusted to the baby and learn, learn the baby's likes and dislikes, and what calms and soothes him. And then, of course, you need to be adjusted to being back at work and being away from your sweetie. And it's a hard adjustment. The hardest adjustment is on you. Make no mistake. The caregivers, that's their job. And they expect to have a transition period, and they expect babies to cry, and they expect to try 10 different ways to soothe your baby, because nobody likes to be in a room with a crying baby, and it sets off the other babies. And so they absolutely will do their darndest to help keep your baby content. They really will. That's their job. And it's not an extra strain on them, and nobody likes to be with a crying baby, so they will help your baby feel comfortable. And your baby lives in the here and now. Either he's hungry or he's full. He's sleepy or he's cranky. He's happy, he's engaged. He is not in childcare thinking, oh, I hope my mom doesn't miss me too much. I hope she's eating well. I hope they're being nice to her. He's just living. He's like, ooh, my hand in my mouth. Awesome. Ooh, milk. Ooh, I'm tired. Sleep. So, he's going to be engaged, and he'll be very interested in what's going on, but give everything time. It will take at least a week for everybody to settle in. And what the baby does in childcare during the first few days is not an indicator of what's to come. So some babies will plow through an astronomical volume of milk, because every time they open their mouth and make a squeak, the caregiver is right there sticking a bottle in. Other babies will be very discerning and refuse the bottle, and will eat very little or none at all, or just eat 4 ounces during the entire first day or two of childcare. And don't worry, they're going to settle in. So don't read a whole lot into how the first couple of days go. And also remember that how you breastfeed when you're home with your baby is going to be different from how your baby eats in childcare, and both of those things are going to be different from how and when you pump milk at work. So if you're away from your baby for about 9.5, 10 hours, an 8.5-hour workday and commuting time, if you were at home, you might breastfeed your baby 5 or 6 times during that time frame. At work, you're going to express 3 times, and your baby is probably going to eat 3 to 4 times during that time frame. So those things, they don't have to be the same every day. They don't have to be at the same times. It doesn't matter what time you would usually nurse at home to when you would usually pump at work. When you pump at work, it doesn't have to be at the exact time every day. You want to look for your opportunities for pumping, and make sure that you are getting your pumping sessions in, so that you're maintaining milk production and you're bringing home the 12 or 15 or 16 ounces of milk each day that you need for the next day at childcare. And your baby in childcare is going to be eating in a different way. So he's going to be eating what I call bolus feedings. He's going to be eating larger volumes a little bit less frequently than if he were breastfeeding. Okay, let's see. Mom liked the answers about the snack packs and has a good freezer supply, and this is great. Okay, I think we're getting ready to wrap up. I want to answer this mom who's about to have a baby. Congratulations, it's so exciting. She says, Nancy, I would like to ask you if you would know something about breastfeeding when a woman has Kallmann syndrome. I will have to look. This mom, I don't know if you I'll have to, I don't know what that is, so I'm going to look it up and come up with some ideas for you. And I don't know if you have my email address, which I don't give out broadly, but I will, why don't you, are you on Twitter, this mom? I don't know if you're on Twitter. You can tweet me, and I will private message you my email address and follow up with you. But I will direct you. I'm glad you watched some of the webinars on the first days of breastfeeding. I will direct you to another webinar called Slower Starts to Breastfeeding, which is one of my favorites. And there are 50 million different reasons why sometimes people get off to rocky starts with breastfeeding, or things don't go exactly the way they wanted or hoped, or there are extenuating circumstances, which could be a pre-existing condition or a new medical concern on the mother's side or the baby side, or the baby comes early or whatever. So there's a lot of reasons why breastfeeding, the baby isn't born vaginally, crawls right up, waves hello, and latches right on, and mom and baby go nursing off into the sunset. It doesn't always happen that way, and that does not mean that, number one, your baby can't be getting breast milk, number two, that you can't initiate and maintain full milk production, and number three, that you can't put the pieces of the puzzle together down the road, because all of those things may be very possible. Now, let's face it, sometimes there are situations that make things more challenging. Baby may have a tongue tie or oral anatomy issues, or need, open cardiac surgery or something. Or maybe mom has certain medical conditions that actually impact her ability to make a full milk production. But those things are more unusual. And the typical situation where a baby is a little early, a little jaundiced, a little sleepy, won't latch, mom has severe nipple pain, it just takes longer to get everything going. Mom's using a nipple shield, supply takes a longer time to establish, yada, yada, yada. These things happen all the time, and we can work on them, and you keep your eye on the prize, and you have to get good advice early on, because what is absolutely key is, number one, baby is fed and then becomes healthy and sturdy and can then go on to learn to breastfeed. And number two, that milk production is initiated and then maintained. When you have a healthy baby and a mom with a full milk production, all things are possible. All things are possible. Even a baby who's 5 weeks old, who's never successfully latched on the breast, it is still possible. So I don't know that syndrome off the top of my head, so I'm going to do a little research, and please get back to me. All right, and breastfeeding jaundice, last question. 1-month-old's Billy levels aren't coming down fast enough. Pediatrician recommended doing formula just for a few days. Assuming it is breastfeeding jaundice. So that's called breast milk jaundice. Breastfeeding jaundice is actually different. Breastfeeding jaundice should be named not enough breastfeeding jaundice. That's actually what happens during the early weeks when the baby is not getting enough milk and has not flushed out the bilirubin adequately. Breast milk jaundice is a longer lasting, different type of jaundice, and it can take a long time to resolve. And it is true that usually if you interrupt the breastfeeding and do 48 hours, 24 or 48 hours of formula, you see a big drop in the bilirubin levels. And really the reason they do that is not because the bilirubin levels are dangerous, but to confirm the diagnosis, and it rules out that there's like a liver failure issue or something like that. But if you have not given formula, I would talk to the pediatrician about and do a little bit of research on your own about whether or not this is actually required, because it really doesn't do anything to make the baby healthier, and it really does change the bacterial makeup of your baby's intestines. It changes the intestinal flora and potentially sensitizes your baby to a foreign protein. So if you give a little bit of formula here and there already, then it's not such a big deal, because you're not changing everything. I don't mean it's not such a big deal. I mean, you've already done that. You've already done those changes. And so interrupting breastfeeding by expressing and storing milk and giving 24 hours of formula, it doesn't, you're not introducing something that hasn't already been introduced. But in general, if a baby is doing well and just has prolonged bilirubin and a little bit of jaundice to the skin at 1 month of age, it just takes time. And I can point you in the direction of some good links for that. Academy of Breastfeeding Medicine is a good one. I think it is abm.org, maybe, Academy of Breastfeeding Medicine. If you Google that, I can post the link when I'm off mic. They have a very good protocol and information about the 3 different types of jaundice, because there are 3 different types. Okay, got to wrap up. Hillary, thank you so much for moderating today. You're very moderate. And attendees, thank you so much for coming and asking great questions. And what else can I tell you? Tuesday, the sleep webinar at 12 noon with myself and Meg. We're going to do all questions and answers, so no planned topic, and that's a rare thing in the sleep webinar world, so come by for that. And then next week, next Thursday, I don't know what I'm going to talk about. You guys can tell me. Do you have a topic that I haven't covered yet that you want me to? And if I promise to post any links, remind me now what they are. I'm going to go off microphone. I wish you all a beautiful, healthy, milk-filled week. And Ruth, if you have your, I don't know when you're due, but it's soon. If you have your baby before next week, congratulations, and we can't wait to see you back and hear about your beautiful little one. Okay, everyone, bye-bye.